going to see the autonomic dysreflexia. This is usually a activation or overactivation of the sympathetic pathway that could be normal, but there would be no parasympathetic pathway compensation. So here we have the classical patient that has a spinal cord trauma or injury, and now it has paralysis of the extremities, etc. So when there is something that triggers the sympathetic activation, for example, could be a overflow bladder. Yes, in a normal person, for example, when the bladder is full, very full, there is sympathetic activation, and there is a compensatory parasympathetic response, and so nothing happens. But in a patient with paralysis or trauma to the spinal cord, then there is no parasympathetic compensation or parasympathetic compensatory response, and so there is just the sympathetic activation because there were no parasympathetic response. So below the level of the lesion, there is no compensation. Above the level of the lesion, there could be compensation. But if it is a lesion above T6, there would be a disaster, and the sympathetic response is extremely powerful, that there could be could not be overcome by any parasympathetic response that could be there. So the patient would have tachycardia, hypertension, and we need to treat first the hypertension with putting the patient on a orthostatic position that would decrease the blood pressure. We will also control the blood pressure with nitrates. We could give alpha blockers in order to try to decrease the blood pressure, and maybe beta blockers to decrease the heart rate. But also we need to treat the thing that is triggering this sympathetic response. So we will do immediately decatheterization of the bladder. So this is the classic example. Here the clue is that there is a parasympathetic response that is not that now cannot be overcoming the sympathetic response. So the sympathetic response is overcome, and so this disastrous thing can happen. So this is what happened on a patient with paralysis or something like that that triggers the sympathetic pathway.